Hi, Dr. Paul here from Hjort Chiropractic, and today we're going to talk about what is probably the most underdiagnosed source of back pain, the sacroiliac joint. Now the sacroiliac joint is the joint that is between the sacrum and the iliac bones. So you have two sacroiliac joints, left and right. So your pelvis is made up of these three bones and your sacroiliac joints are on both sides. Low back pain comes from the spine, and so this is actually a problem in the pelvis. This patient has a sacroiliac condition, and I'm going to show you where the sacroiliac joints are. Now, you have bony prominence on both sides of your pelvis, your iliac bones. If you slide on the inside, some people have little dimples here, and you'll have a little prominence on both sides, your posterior superior iliac spines. If you drop on the inside of that, you'll drop right onto the sacroiliac joints. So you'll feel a little indentation right through here. Quite often when you have a sacroiliac condition, it'll be tender in here on one side or the other, or sometimes both sides. Now like I said, when people say they have hip pain, I always say point to your hip, and quite often they'll point right back here. And that's probably going to be a sacroiliac joint. Now your hip joint is deep inside your pelvis out here and lower down. Okay, let's give this sacroiliac joint an adjustment and see how it helps. Now I'm going to demonstrate a sacroiliac adjustment. So this is a very, very safe procedure to do by a properly trained professional. And we're going to adjust this right sacroiliac joint. Okay, just let it relax now for me here. Very good. Okay. Now the sacroiliac joint adjustment like that is one of the most effective, if not the most effective way to treat a sacroiliac condition. Some studies suggest that 25% or more of back pain problems actually come from the sacroiliac joint. Now quite often in my practice people come in and say they have a hip problem. So I always say, point to your hip for me. And quite often, probably more often than not, they will point to their sacroiliac joint. So a lot of people that think they have a hip problem actually have a pain from their sacroiliac joint. Now the sacroiliac joint can cause local pain right in your pelvis, but quite often it can have pain radiate into your leg, buttock, or groin, or hip. So it's a tricky condition, and it's often misdiagnosed as a disc problem or a muscle problem or osteoarthritis, things like that. And the problem with that is that if it's not properly diagnosed, it might not be properly treated. One problem with sacroiliac joints as far as diagnosis goes is that most sacroiliac problems don't show up on x-rays or MRI scans. So if you have a back problem and you go get an MRI scan or x-ray, most of the time you're not going to be able to see a sacroiliac joint problem. So what happens is some other conditions, especially disc problems, show up very vividly on MRI scans. And so quite often people will have a disc condition that's not causing pain, and it shows up in the MRI scan, and then that's the diagnosis, discogenic pain or pain from the disc, when actually the pain can be coming from the sacroiliac joint. Now there's ways to differentiate between a sacroiliac joint and a disc problem. And we're not going to talk about that today because that gets a little bit involved, but there's basic tests we do in my office that differentiate between different sources of back pain. So that's quite a common problem where people get the wrong diagnosis. And if that happens, a lot of times they don't get the right kind of treatment. And if they don't get the right kind of treatment, quite often they don't get relief from their condition.